What if I told you that a habit you've had for decades, one that feels completely private, completely harmless, could be quietly changing your prostate in ways that most doctors never even discuss with their patients? And what if I told you that some of those changes are actually helpful, but others could be slowly setting the stage for some of the most disruptive health problems men face after 60? Stay with me, because what you're about to hear could genuinely change how you age. I'm Dr. Daniel, and welcome back to Dr. Daniel Brooks. Advanced Health, the channel where we have the real conversations about men's health, the ones your doctor might not have time for in a 10-minute office visit. Today we're talking about your prostate, your hormones, your habits, and ultimately your quality of life. And yes, we're going there because your health deserves honesty, not silence. Now, before we go any further, I want to speak directly to you for a moment. If you're a man in your 60s, 70s, or even 80s, chances are you've noticed that your body doesn't respond the way it used to. Maybe you're waking up 2 or 3 times a night to use the bathroom. Maybe your urinary flow has weakened. Maybe you've experienced some discomfort in the pelvic area that you've quietly brushed off as just getting older. You've told yourself it's normal. You've kept it to yourself. You haven't mentioned it to your doctor because, honestly, it feels awkward, even embarrassing. I want you to know something. You are not alone. And none of this is something to be ashamed of. In fact, the men who thrive as they age are exactly the men who lean into these conversations rather than away from them. So the fact that you're here, watching this right now, already puts you ahead of the curve. Today, I'm going to walk you through 4 surprising changes that happen inside your prostate when masturbation becomes a daily habit after the age of 60. Some of what I share will surprise you. Some of it may even concern you, but all of it will empower you. And the 4th change, the one almost no one in the medical community talks about openly, may be the single most important thing you hear today. So don't scroll away. If this is your first time here, please hit that subscribe button and ring the notification bell, so you never miss a video. We publish science-backed, doctor-explained health content every week, specifically for men who want to live longer, feel stronger, and understand their own bodies better. And if you're finding this video valuable, drop a 1 in the comments right now. It helps me understand what content is resonating with you, and it helps this information reach the men who need it most. Let's get into it. The first change is one I witness more than almost any other in my clinical practice, and yet it's one of the least discussed. It has to do with your pelvic floor muscles and a slow, silent process of irritation that builds up over time, quietly, steadily, and often without obvious warning. Let me introduce you to someone I'll call Robert. He was 67 years old when he walked into my office, sharp, active, and genuinely proud of how he'd maintained his health over the years. He exercised regularly, watched what he ate, and had kept up a daily masturbation routine that he genuinely believed was good for him. "It keeps me young, Doc," he said with a grin, and honestly, I respect that kind of confidence. But underneath that smile was something he'd been quietly ignoring for months. A persistent pressure in his pelvis, frequent nighttime trips to the bathroom, and a strange tingling sensation during orgasm that hadn't been there before. He'd chalked it all up to aging, but it wasn't just aging, it was pelvic floor fatigue. And an irritated, inflamed prostate quietly paying the price for a habit done without rest or variation. Here's what most men don't realize. Every single ejaculation involves a coordinated muscular effort. Your prostate and the surrounding pelvic floor muscles contract rhythmically to propel fluid outward. When you're in your 20s or 30s, your body recovers from that effort quickly and efficiently. But after 60, the biology changes. These muscles are no longer as elastic, as resilient, or as quick to recover. Daily repetition without adequate rest begins to create low-grade inflammation around the prostate. Minor at first, barely noticeable, but inflammation, when it's left unaddressed, doesn't stay minor forever. What starts as a dull ache in the perineum, that region between your scrotum and your tailbone, gradually becomes a heaviness near the bladder. Then comes the feeling that you're never fully emptying your bladder. Then the nighttime bathroom trips increase from 1 to 2 to 3. Then comes discomfort during or after sexual activity. And if none of those signals are taken seriously, that inflammation can evolve into a condition called chronic nonbacterial prostatitis, a frustrating, persistent condition that affects both physical comfort and quality of life significantly. I've had patients tell me this condition turned them into, in their own words, prisoners of their own bathroom. Men who used to sleep through the night suddenly found themselves up every 90 minutes. Men who loved travel began avoiding long car rides and flights. Men who had been confident, capable and independent started organizing their entire day around proximity to a restroom. That is a steep price to pay. And the tragedy is that most of these men had no idea the daily habit they believed was healthy was quietly contributing to their discomfort. So what's the practical takeaway here? If you're masturbating daily and you've started noticing pelvic pressure, urinary changes, or discomfort during orgasm, listen to those signals. Your body is communicating with you. Reducing frequency to 3 or 4 times per week can give your pelvic floor muscles and prostate the recovery time they need. Gentle pelvic floor stretches, particularly child's pose, deep squats, and hip flexor stretches, can relieve tension in that area. And warm baths or a heating pad applied to the lower abdomen can help reduce inflammation when symptoms flare. Simple interventions, meaningful relief. But the story doesn't end with muscles and inflammation. Because what's happening deeper inside, at the hormonal level, is something I want you to understand clearly. Because it affects far more than just your prostate. Let me tell you about a patient I'll call Alan. He was 70. A retired engineer, precise and methodical by nature. He didn't come to me complaining of pain. He came to me frustrated. "Doc," he said, leaning forward in his chair, "I still have the drive, but something feels off. My mood swings for no reason. My hair is thinning faster than it was a year ago, and my urination has become slow and uncomfortable. Could it be stress?" I told him it wasn't just stress. It was his hormonal environment, already shifting because of age and being pushed further out of balance by the daily frequency of his ejaculation habit. Most men are genuinely surprised to learn that ejaculation directly affects their hormones. They assume the body simply produces and releases, with no broader consequence. But inside a man's body, especially after 60, ejaculation triggers a cascade of hormonal responses that ripple outward in ways that matter deeply. Here's the key biology, explained simply. Testosterone, the hormone most associated with male energy, confidence, muscle mass, and libido-free, begins its natural decline after about age 30, and that decline accelerates in your 60s and beyond. Meanwhile, a more potent derivative of testosterone called DHT, or dihydrotestosterone, remains actively present in the body. In younger men, the relationship between testosterone and DHT is balanced and manageable. But as testosterone levels drop and DHT becomes more proportionally dominant, the prostate tissue becomes increasingly sensitive to DHT's stimulating effects. Now here's where frequent ejaculation enters the picture. Each ejaculation causes a brief, temporary dip in DHT. But the body, sensing that dip, responds with what we call a compensatory rebound. It overproduces to restore balance. In older men, this rebound often overshoots the target. Day after day, this pattern, drop, rebound, overshoot, repeat, creates a cycle of hormonal fluctuation that keeps the prostate under persistent hormonal stimulation. The prostate tissue responds to that stimulation by thickening and enlarging. This is the biological foundation of benign prostatic hyperplasia, or BPH, an enlarged prostate, which affects more than half of all men over 60 and nearly 90% of men over 80. You might not notice BPH developing. It doesn't announce itself dramatically. It creeps in, a urinary stream that's a little weaker than it used to be, a feeling of urgency that comes out of nowhere, the sensation that you haven't fully emptied your bladder. Then the nighttime urination begins, then the hesitation at the start of urination. And for some men, if it's left unaddressed, BPH can progress to urinary retention, a situation where the bladder cannot empty at all, which sometimes requires catheterization or even surgery. But beyond the physical, they know the hormonal imbalance I'm describing also affects your mood, your energy, your mental clarity, and your sense of yourself as a man. When testosterone dips and DHT fluctuates erratically, men report feeling irritable, foggy, unmotivated, and emotionally flat. The things that used to bring satisfaction begin to feel hollow. That's not weakness, that's biology, and it's biology you can address once you understand what's happening. Practical steps here include speaking to your doctor about having your testosterone and DHT levels tested, simple blood work that far too few men over 60 actually ask for. Incorporating resistance training into your weekly routine has been shown in multiple studies to naturally support testosterone levels. Zinc-rich foods like pumpkin seeds, legumes and lean red meat support healthy hormone balance. And reducing ejaculation frequency, particularly during periods when you notice urinary or mood-related symptoms, gives your hormonal environment time to stabilize. Now I want to move into the third change, and this one is, in my experience, the most dangerous of all the physical changes, because it doesn't cause symptoms, it erases them, and that distinction can, quite literally, be the difference between life and death. Some of the most emotionally difficult conversations I've had in my career have not been about delivering diagnoses. They've been about sitting with a man while he processed the weight of a missed opportunity, a window of time when his body was trying to tell him something and he simply wasn't listening. I'll call this patient Carl. He was 73 years old, soft-spoken and kind when he sat across from me with tears in his eyes. Not from pain, from regret. He told me he had no idea anything was wrong. No blood, no dramatic pain, no obvious red flags. He'd had prostate cancer, and by the time it was found, it had already spread beyond the gland. I asked him gently whether he had noticed any changes over the past year or two, anything at all that felt different. He sat quietly for a moment and then said, "Well, things felt different during climax. Weaker, somehow, less sensation, but I thought it was just aging." He paused. Was it a warning? It was. His body had been sending signals, and daily masturbation, approached as a mindless, mechanical habit rather than a moment of genuine body awareness, had effectively muted his ability to receive them. This is the phenomenon of desensitization, and it's far more consequential than most men realize. When any physical experience becomes completely routine, completely automatic, the brain stops registering the details. You stop noticing subtle shifts. You stop perceiving change, and your prostate, which can only communicate through sensation, pressure, flow, temperature, intensity, loses its voice. The details that matter include things like changes in semen color or consistency, a reduction in ejaculate volume, decreased intensity of orgasm, new pressure or discomfort during climax, or a change in how urination feels before or after, These are not minor, irrelevant observations. These are your body's early warning system. Prostate inflammation, infection, and even cancer all begin quietly. They whisper before they scream, and if you've become desensitized to your own body's signals, you'll miss the whisper entirely. My strong recommendation here is to approach intimate moments with genuine mindfulness. Slow down. Pay attention. Notice what's the same and notice what's different. Keep a simple mental log of how things feel from week to week, and if something changes, don't dismiss it as aging. Bring it to your doctor. A PSA blood test, a simple physical exam. These are fast, accessible, and often life-saving. Early detection of prostate cancer has a nearly 100% 5-year survival rate. Late detection changes that picture dramatically. Your body is always talking. The question is whether you're listening. Now we come to the fourth change, the one I promised you at the beginning of this video. And I want to be honest with you, this is the change that moves me the most as a physician, because it doesn't show up on any lab test. It doesn't appear on a scan, but it may be the most dangerous of all four. I want to tell you about a man I'll call Frank. He was 76 years old, a widower living alone, no family nearby, a quiet routine, a small apartment, and days that passed with little variation. When he came to see me, it wasn't for a specific physical complaint. He just seemed tired, not physically, but somewhere deeper. During our conversation, he mentioned, almost as an aside, that he masturbated daily. Not out of desire, he told me, out of habit. It helps me pass the time, he said quietly. It keeps me from feeling alone. What struck me in that moment wasn't what he was doing. It was what he was substituting it for. Connection, meaning, human presence. This is something I see with a frequency that breaks my heart a little each time. For many older men, particularly those who live alone, who've lost a partner, who've become disconnected from family or community, sexual self-stimulation quietly transforms from a physical act into emotional anesthesia. It numbs the loneliness, it fills the silence, it becomes a way to move through the day without having to feel the full weight of what's missing. And while there is absolutely no shame in the act itself, the problem is what it can gradually replace. Real human contact, honest emotional intimacy, the motivation to engage with the world, and most importantly, the practice of genuinely caring for yourself. I've watched men, capable, intelligent, strong men, slowly shrink their worlds down to their four walls. They stop calling old friends. They stop reaching out to their children or grandchildren. They decline invitations. They postpone doctor's appointments. They stop paying attention to how they feel. And over time, without ever making a conscious decision to do so, they begin to disappear from their own lives. The research on loneliness and health in older men is stark. Chronic social isolation is associated with higher rates of cardiovascular disease, cognitive decline, compromised immune function, and significantly shorter life expectancy. Loneliness isn't just an emotional experience, it is a physiological one. And when a habit that provides momentary comfort begins to substitute for the real human connection that your biology genuinely needs, the long-term cost is profound. So what do? You begin to rebuild. Not dramatically, not all at once, but intentionally. You make one phone call this week to someone you've been meaning to reach out to. You join one group, a walking club, a faith community, a hobby group, anything that puts you in regular contact with other people. If you have a partner, you invite them back in, not necessarily sexually, but emotionally. You share what you've been carrying, you let yourself be known, and you make the appointment, you call your doctor, you schedule the PSA test you've been putting off. You treat your health not as a burden, but as the gift it genuinely is. Before I close, I want to bring everything together and leave you with something practical and actionable that you can start today. If you masturbate daily and you're over 60, consider reducing frequency to 2 to 3 times per week. This isn't a moral judgment, it's a physiological recommendation. Your pelvic floor muscles need recovery time. Your hormonal system needs stability. Your body needs space to communicate with you clearly. Approach those intimate moments with mindfulness, not mechanical routine. Slow down. Notice what you feel. Let those moments be a genuine check-in with your body, rather than a way to check out from it. Incorporate regular physical activity, particularly resistance training and walking, to support testosterone levels, prostate health and mood. Eat a diet rich in anti-inflammatory foods. Tomatoes for lycopene, fatty fish for omega-3s, green leafy vegetables and cruciferous vegetables like broccoli and cauliflower that have been specifically linked to prostate health in multiple large-scale studies. Limit alcohol. Manage stress. Prioritize sleep. Get screened. A PSA test is a simple blood draw that takes minutes. A prostate exam is brief and far less uncomfortable than most men expect. These are not big asks. They are small acts of self-respect that can change the entire trajectory of your health. And pursue connection, reach out, show up, stay present, not just in your body, but in your relationships, your community, and your own sense of purpose. If you've stayed with me through this entire video, I want to say something directly to you. Thank you, not just for your time, but for your courage. These are not easy topics. Most men grew up being told to stay quiet about their bodies, their struggles, and their private lives. The fact that you're here, engaging honestly with information that could genuinely change your health, tells me everything I need to know about the kind of man you are. Your prostate is not just a small gland. It is a reflection of how you care for yourself, how honestly you listen to your body, and how seriously you take your own well-being. And that well-being matters, not just to the people who love you, but to you. Aging does not have to mean fading. It can mean deepening, strengthening, becoming more intentional, more aware, and more genuinely alive than you've ever been, if you choose it. If this video was valuable to you, please share it with a man in your life who needs to hear it. A brother, a friend, a father, a neighbor. These conversations save lives, but only if they reach the people who need them. Leave a comment below telling me which of the 4 changes surprised you the most. I read every comment, and I genuinely want to know what landed for you today. Subscribe to Dr. Daniel Brooks, Advanced Health if you haven't already, and hit that bell so you're notified every time we publish. We'll be here every week with honest, research-backed, doctor-explained content for men who refuse to settle for anything less than their best health. I'll see you in the next one. Take care of yourself, because you are absolutely worth it.